Hello, I'm Femi Oladapo. I'm the head of Maternal and Perinatal Health Unit at the Department of Sexual and Reproductive Health and Research at the WHO. Welcome to the Masterclass.
I'm Hadiza Shehu Galadanci, a professor in obstetrics and gynecology at Bayero University, Kano, Nigeria, and also the director of African Center of Excellence for Population Health and Policy, a World Bank-supported research center.
Today, we'll be talking to you about a WHO-led roadmap to combat postpartum hemorrhage between 2023 and 2030. So why did WHO decide to develop a roadmap for postpartum hemorrhage? There are 4 key reasons. Postpartum hemorrhage is the leading cause of maternal death worldwide. It accounts for over 25% of maternal death, and it's been a difficult situation to deal with for several decades. Importantly, there was also innovation deficit in the area of postpartum hemorrhage. For the last 30 years, we've only been able to identify 2 medications to prevent or treat postpartum hemorrhage. And that's not good enough. That's not what we have in other areas like HIV and some other disease conditions. At the same time, the implementation bottlenecks are huge. Donors and countries are not well coordinated in their actions to improve outcomes. And lastly, advocacy is not sufficient for something that kills a large number of women globally, and we needed to do something about that. The guidelines that are released by both international bodies and national bodies are not always consistent, and the end users always find it difficult to decide on which one to use. So we decided to bring together several stakeholders across industries and private sector, academic institutions, professional associations, NGOs, and just about everybody that works in postpartum hemorrhage space to discuss 4 key areas. Research is very important, guidelines or norms and standards, implementation bottlenecks, as well as advocacy. At the summit that we held in Dubai in March 2023, we came up with great ideas on how to move things forward. And my colleague will be telling you about the call to action that was decided on by 135 stakeholders that attended this summit.
Our stakeholders all agreed that we must take our call to action very seriously right from day one. The international organizations must unify. They must have a leader who will take the lead in trying to address the issues of maternal mortality arising from postpartum hemorrhage. The government, the ministries of health, must strengthen our healthcare system by providing healthcare providers as well as ensuring that the services are available that will address the issues of postpartum hemorrhage. The researchers and the academicians will have to do researches that are addressing the public health needs that are related to postpartum hemorrhage. And importantly also, they should be doing implementation science research that will address how we're going to be able to implement the evidence-based best practices that actually address postpartum hemorrhage and maternal death arising from that. The professional bodies must make sure that they improve the capacity of our healthcare workers so that they will be able to provide quality services to our women that come with postpartum hemorrhage. And also the women leaders and the CSO must advocate to our governments because we must have political will. The issue of postpartum hemorrhage has to be on the table. We also have donors. Donors agreed that they must also have a unified voice. We should all increase funding as far as funding research, funding innovative tools for addressing postpartum hemorrhage. And in fact, we hope that we can have a basket of funding that can really help us in trying to address research that can really give answers to trying to find solutions. So at the end of the day, every single stakeholder agreed that we must harmonize our guidelines. We must have a unified voice for our advocacy. We must reduce the implementation gap, and we must have more funding for research and have a single agenda for research. We all are really going to take action so that we end the unacceptable maternal mortality arising from the #1 cause of maternal death, which is postpartum hemorrhage.